Welcome to a new edition of Obeid Dental Journal Club. Today's article is an interesting article because it is a technical article. It's not a study or not a research. And the reasons why I selected this one because I thought that a lot of us can use it for our daily practice. The article is a simplified approach for restorations of worn dentition using the full mock-up concept. It is a clinical case report, and it is from the International Journal of Periodontics and Restorative Dentistry, volume 38, number 2. That's the March and April edition. The reason why I like the article because it talks about solutions for common problems we're facing when we have to deal with worn dentitions that require raising the vertical dimensions and the commitments to full crown restoration. Historically, when we have patients that walk in through the office who have a lot of worn dentitions that require opening the vertical dimension, most of the time, if not all the time, we have to prepare these teeth to receive a full coverage restorations, whether that restoration used to be a porcelain fused to metal, or that restoration is zirconia crown or another of all ceramic restorations such as Emax and whatever you use for your crowns. And eventually, with the progress of the all ceramic material, new techniques started to come along, and this article described one of these techniques. Basically, you go through the same process where you go and you do your diagnostic workup, your wax up, and then you take the wax up and you transfer it to the mouth through the usual technique of the mock-up try-in using a temporary materials with your silicone index. The difference with the preparation, remember, this technique will actually will have on the anterior a buccal veneer and a separate lingual veneer. So it is almost like a sandwich technique. Actually, they call it the sandwich technique. The principle of the preparations for the anterior teeth will require leaving very light margins where we can position the veneers on and leaving the contact and leaving as much of the enamel circle all the way around. When we look at it from the lingual aspect, you'll see that you're going to have on the anteriors, you will have a veneer on the buccal, and you're going to have veneer on the lingual. They are not going to join together with ceramic versus ceramic. You're going to have a layer of enamel that will separate the buccal and the lingual, and it helps bond each one of them. The back teeth will have an onlay-like preparation, and that's how the preparation should look like. You need to have an enamel band all the way around. Maybe you do a 0.5 millimeter of preparation, and the importance of leaving the enamel band is to create a good seating area, plus the advantage of bonding to enamel and the seal of the occlusal onlay. The bottom line, you are dealing with a case that you have to open the vertical dimension 3 to 4 millimeter. There is no requirement to do 3 months of a patient wearing a temporary removable appliance to test the vertical, because you're just creating thickness for the restorative material. The preparations require a different technique because you are looking at two separate veneer prep, almost no preparation in a way, just a minor margin prep on both the buccal and the lingual. Of the anterior, you're going to have a buccal veneer, lingual veneer. On the back teeth, you will have a minimum preparation for a non-lay style all ceramic restorations, and then you go through your conventional bonding technique, which is in this situations they're showing it using the rubber dam. You can do that, but if you can control the environments, you really don't have to go to a rubber dam and using any bonding cements that you use and you like. In summary, this article really gives light to a new way of thinking, utilizing the advantage of all ceramic material, with a desire not to prepare the teeth aggressively. For patients who doesn't want to have their teeth grind so much and they are suffering from wear, this kind of procedures can work very well with them. And that is the reasons why I thought this article is worth talking and discussing about. And I'm sure that you will have a lot of use for it in your practice. In case you have any problems, you can always email me at drobeid@obeiddental.com, and I'll be more than happy to answer your questions. Hope you enjoyed today's article, and we'll see you next time.